My name is Josh Hackel. I'm a primary care sports medicine physician at the Andrews Institute in Gulf Breeze, Florida. I've been using PRP, or platelet-rich plasma, for the past 3 years. I've treated over 200 patients in that period of time. Patients that I use PRP on are suffering from medial and lateral epicondylitis, injuries to the ulnar collateral ligament, also patella tendon injuries or patella tendinopathy, Achilles tendinopathy, medial and lateral tendinopathy of the ankle. I'll also use PRP on plantar fasciitis as well as greater trochanteric bursitis. What I look for in PRP is what the literature would suggest. What is needed is 1.5 to 3 million platelets to stimulate cellular proliferation and angiogenesis. When treating patients with tendinopathies, I want a PRP product that will deliver the appropriate growth factors as well as CD34 stem cells. And Harvest Technologies concentrations provide a product that meets that concentration better than any of the competitors. The Smart Prep system is a simple process. My medical assistant will take the blood from the patient through a venous draw and prepare the PRP for me. I then take the PRP product and inject the PRP wherever it may need to be delivered under ultrasound guidance. Overall, it's a simple process. It takes me probably 10 to 15 minutes to do my component of the procedure. I started looking at PRP after having difficulty treating these tendinopathies. The traditional therapies were not working like we had hoped. We have been looking for new techniques to try and treat these tendon issues that with traditional therapies are difficult to manage. When I first read about PRP, the work from Alan Mishra and others, this was a potential solution. After reading different work by Dr. Giusti from Italy, talking about cellular proliferation and angiogenesis, work from Dr. Kevi at Harvard Medical School. These were very important papers that have helped me make a decision on which product to use. I see many patients that have had soft tissue injuries. Traditional therapies are not necessarily the best option. For example, injecting tendons with cortisone can, in theory, degenerate those collagen fibers. PRP allows us a new treatment option to treat these soft tissue injuries. We've been very successful in treating these soft tissue injuries with platelet-rich plasma. My treatment protocol is based off how the patient is really feeling. They may take 4 to 6 weeks before some improvement is felt. So I make sure the patient understands that this is not an overnight treatment, but it is a new treatment option that we are very optimistic to be able to resolve their tendinopathy or soft tissue injury. It may be between 4 and 12 weeks between injections. It really depends on the severity of their injury and how the patient has responded to the previous injection. My advice to our colleagues across the country would be to consider the traditional therapies, consider your success with those traditional therapies, and consider PRP. Based on my experience, we've had excellent results to resolve these soft tissue injuries with my patients. I believe regenerative medicine is the future. I feel that PRP and treating soft tissue injuries, has a wonderful opportunity to really change the way we practice medicine. There's a lot of research that has to be done. There's a lot of questions that we still have. But overall, we're seeing significant results, even early in the infancy of this science. So I'm very excited about utilization of PRP, fat grafting, stem cells, etc. These will be on the forefront of medicine going forward. Harvest Technologies has been an excellent company as far as support